Uganda is the pearl of Africa, and the people's greatest desire is to be healthy, to stay away from small diseases, and the biggest evil himself, HIV/AIDS. We have been working with a number of non-governmental organizations and governmental organizations to lift Uganda up. Among these organizations is SURFACE-UGANDA. It simply means supporting families living with HIV/AIDS through capacity enhancement. SURFACE-UGANDA is located in Gulu district, the northern part of Uganda, with its branches all over. It began in April 2003 as a community-based organization with the mission to improve the health of children and communities, including orphans, vulnerable children, child mothers, widows, and the youth affected by HIV in northern Uganda.
The main objectives of this project was to prevent HIV spread or transmission in the most vulnerable groups, which included the disabled, people who are living with HIV/AIDS, and the orphans and the children, abducted children, returned from the war front.
The areas you are looking at as SURFACE-UGANDA, areas like HIV/AIDS is a key area that, as a district, we think we need to give more attention. As I speak right now, HIV/AIDS prevalence rate in Gulu district is at 11.3%, which is much higher than what we have at the national level. It's actually, to me, I think it's much higher than the prevalence rate in any of the districts in Uganda.
Seemingly, there are going to be even more children born with HIV/AIDS because precaution measures don't seem to be taken very seriously these days. Uganda took up the fight for HIV/AIDS with a lot of vigor, but I think it has cooled down. Thus, the need for more concentrated effort of sensitizing the community is very important. And this has been the role played by SURFACE-UGANDA many times among the community.
Our woman Jennifer comes from a group of 35 adults and about 20 children. Together, they have been getting support and teachings from SURFACE-UGANDA.
Well, we are here today because it's actually a blessing. We are visiting one of the groups SURFACE-UGANDA is supporting. The group is called a Whole King Wage group, which is actually here in Bwangatira. It's found here in Bwangatira. Bwangatira is located in the north of Gulu town, Pateko Palar Road. Konyo bertima pon ma chen ber ka fonyo wa tikiet me de afu manya mai lam jem ne mo tiegi ti mario upo pa ko di ki gwero be na no ki tika wa ti kancha ki dong aper be shumba jem apol gar jem ka ti por ki mo chawa na.
As a group leader, Otema Fred has always been working hand in hand with other group members in order to generate income and bring more food security in their community.
we need to know that agriculture contributes to about 86% of our economy. That means about 86% of the total population rely on agriculture. Unfortunately, because of abject poverty, level of production is still very low. And so there is need to give more attention and put a lot more effort in seeing that the aspect of food security is taken seriously.
SURFACE has not only been teaching about HIV/AIDS awareness, SURFACE has also taught the community in how to generate and keep money for the needful ones.
Basically, on what we are doing, SURFACE is doing maybe food security project and HIV/AIDS. We have so many categories of the vulnerable people we are supporting. To mention few, we have the category of a child-aided family. We have also the child soldiers, those children who came back from the bush, who has been abducted by corn. And then we also have the category of HIV/AIDS affected people, the clients. And also we have the widows. So we have so many categories of people. The most problem we are facing here is the education. Of course, you know that these children, though we have some other organizations which are supporting these children, but the services are not reaching all of them.
SURFACE-Uganda has managed to teach the village groups in order to generate money and bring in more IGA, that is income generating activities in their own communities. This is one of the vulnerable groups SURFACE-Uganda supported, and they make paper beads in order to earn a living.
I'm by the name called Aloyo Norida Alice. I am an orphan. I school in Kasubi Army Primary School. I make these paper beads to pay for my school fees. I am the member of this group. I have been taught by the chairperson of this group to make these paper beads.
Through support from USAID, the organization has been able to achieve its objectives as planned. 3,914 households were trained on new farming methods which covered agronomy, good hygiene practices, village saving and loan association, post-harvest handling, demonstration and multiplication plots were established. While on HIV and AIDS prevention, over 200 OVCs were supported on poultry keeping. 5,000 households were sensitized on HIV and AIDS awareness. 10,000 IEC materials on HIV/AIDS were distributed. However much SURFACE-Uganda has worked on HIV/AIDS prevention and food security, they still need to do more. But as an organization, they also have challenges.
I would like really to give a big thanks to donors who supported us to make our community, at least they are able to achieve what we had planned.
I think the journey ahead of us is much longer than behind. The work to be done ahead is much more than what you have done. We have only scratched on the back. We have not actually done anything yet.
I would like to appreciate SURFACE-Uganda for what you have been doing, but I also would like to tell you that the work is still long, and we need to do a lot more in transforming the community.
We feel if we could get funding, maybe to support even children who are dropped out from school, it would really be very good for us.
I think the SURFACE-Uganda need to double up even after this. Lesson learned from what you have gone through should be able to be used into doing more programs.
And I must say that it is very necessary that organizations out there whose objectives or goals are HIV prevention, they should be, we would like to call upon them actually, or request that they should come and work with us in this part of the world.
We have also a plan, not only to work in Gulu, but we have a plan to expand to work in the entire actually sub-region and then Lango sub-region. If we could get enough funding, which can really cover the northern part of Uganda. That is our plan in future.